Pop quiz. A 45-year-old client is prescribed amitriptyline for depression. Which teaching should the patient, no, I can't read. Which teaching point should the nurse emphasize? A, this medication may cause sedation, so take it at bedtime. B, you should expect improvement in mood within 2 to 3 days. C, avoid all foods containing tyramine to prevent hypertensive crisis. Or D, it is safe to stop taking the medication abruptly if you feel better. What do you guys think? And the correct answer is A, this medication may cause sedation, so take it at bedtime. Couple things. Number one, if I had a penny for every single time it was reported back to me from a student that they saw this drug on their exam, I'd be a rich woman. I'm not, but I would be. So you do need to know this drug. Something important, you need to know that's a TCA, that's a tricyclic antidepressant. It is not the first line drug for depression. That would be what? Your SSRIs, but it is a second. Something else you need to know about TCAs, you're going to teach the patient that it may cause sedation. So you're going to teach them when they first start taking this medication, they should not be driving or operating heavy machinery until they know how it affects their body. All right, let's move on. Let's look at the other choices because I want you to understand why the wrong choices are wrong. We have B, you should expect improvement in mood within 2 to 3 days. Oh, you crazy as hell. Let me tell you something. When it comes to all the antidepressants, I don't care the class. I don't care if it's a SSRI. I don't care if it's a TCA. I don't care if it's an MAOI. If it is an antidepressant agent, it's going to take weeks. 2 to 4 weeks, depending on the drug. It may even take up to 6 weeks, right? Before the patient has a therapeutic effect and they start to feel that therapeutic effect. Why is that important to teach the patient? Think about it. This is an antidepressant agent. We're giving it to them because they are depressed. If we don't teach them that it's going to take a couple weeks before they start to feel the effects, they're going to look around and they're going to say, I knew it. I knew I was a loser. I knew something was wrong with me because how come everyone else is taking this medication? They're starting to feel better, but I'm not. So you have to warn them. Either that happens or the other thing that may happen is they just stop taking the medication because they don't feel like it's working. And let me tell you something, when it comes to psych or neural drugs, you never stop abruptly, ever, ever, ever. Rule of thumb. C, avoid all foods containing tyramine to prevent hypertensive crisis. No, that would be for what? What kind of drug class would that be? Hypertensive. Oh, MAOIs. So if it was a drug, something like phenazine, which is an MAOI, great. But no, this drug is a TCA. So that's wrong. And last, it's safe to stop the medication abruptly. If you feel better, you know that's false. So the correct answer is a sedation, safety. You're always going to think about safety, but everything else that I told you about the wrong answer choices, you may see it on another exam. So make sure you know all of the information I just taught you.